Hey folks, thanks for tuning in. Welcome to episode 8 of the 21st Century Blues podcast. I'm Tim, and today I'm joined by licensed marriage and family therapist Angela Amoia. For anybody who's listened to episode 3, I believe it was with Kevin Holt, she's the friend of Kevin's that he mentioned. So, really happy to get to speak with Angela today. And we have a really great topic for you in this episode. We'll be talking about psychedelics as medicine and about psychedelic assisted psychotherapy. So, Angela, welcome to the show. Welcome to the podcast. It's really great to get to speak with you. And yeah, thank you for joining me.
Yeah, thank you so much. It's so great to be here and to have this conversation with you.
I agree. I think it's definitely an important one to have. We were just talking before I pressed record that, psychedelics are they have a lot of potential, but they've really only started being used in professional settings and stuff in the past 10 years or so, very recently, because of things like the war on drugs and stuff like that, all of these negative connotations. But before we dive into the specifics of psychedelics and psychedelic assisted therapy, Angela, could you start with giving us a little bit of your background and talk a little bit about your therapy in general before you incorporated psychedelics?
Sure, yeah. Like you said, I'm a licensed marriage and family therapist, and it's actually my 20th year as a clinician. Um, I have done traditional talk therapy for all that time. I worked in substance abuse. I worked with couples. I worked with families, and um, predominantly working with individuals right now. About 5 years ago, I um, was prepared. I also teach at a community college in my area. And so I was asked to teach a death and dying class. And I was preparing some materials for the class and came across a documentary about a study at NYU that was using psilocybin
Mhm.
mushrooms with terminal illness, so cancer patients with a terminal diagnosis. And it totally shifted my perspective and opened up so much. It's just been recently that I have, um, you know, started understanding psychedelics in a different way and started my own journey to learn and grow, and then eventually my own personal healing journey. Yeah, it's been much more recently that psychedelics have been a part of my world. Primarily, I've been the traditional talk therapist prior to that.
So it was psilocybin mushrooms, you said that kind of were these breakthrough where you decided to introduce psychedelics into your practice. What was like the main draw that psychedelics had when you first encountered them, and what was the biggest potential that you saw in how they could maybe transform the way that you did things before them?
Mm. Yeah, I think the biggest thing was just this idea that psychedelics could be used for healing. I grew up obviously, high school and college, and people were partying, and I never participated in that. I didn't do psychedelics, but I my understanding was limited, and it was more of like, oh, they're just like this party drug, and not really. I just felt like they weren't for me. And so seeing that documentary and just having such a shifting perspective as far as the potential for healing. And one of the things that stood out as well was this idea. I have clients that I've had for quite a bit of time, and a feeling of stuckness and them kind of staying in the same spot. They're okay, but they've kind of plateaued. And like diving more into understanding psychedelics as medicine, psychedelics for healing, made me realize that psychedelics can offer a shift, and in a way that talk therapy that talk therapy didn't or maybe couldn't. I think that psychedelics really help us get into our body and embody certain things. Whereas talk therapy, we're in our head. I can tell you the same story over and over again. But if I haven't had that shift in my body, I still react the same. My feelings are still the same. And so working with psychedelics can allow for a shift in the body and an actual change. Not to say, and I don't mean this negatively about talk therapy. There's certainly many, many benefits and changes that happen in talk therapy, but it was something that has stood out with the clients that I felt so stuck with. And then learning about psychedelics as another tool. And so, and it's not a tool for everyone too. There's certain issues or conditions that would rule someone out for using psychedelics as healing, but with the people that it aren't ruled out and are open to the experiences, I see a lot of potential.
So who would you not recommend this kind of therapy to, for example?
Yeah, that's a great question. And I think that depending on who you ask, they would have different
Mhm.
answers. There's people who are doing a lot of research with all different types of conditions or disorders. But a lot of facilitators would probably rule out someone with a schizophrenic diagnosis, a bipolar diagnosis, a history of schizophrenia, psychosis, bipolar in the family. Um, there's definitely a lot to consider because psychedelics create this altered state and can create a feeling of another reality or what some might call a psychosis. And so, um, those disorders are being looked at and researched, but that as far as my facilitation, I would rule someone out or refer them to somewhere else, or maybe suggest some breath work and body work or energy healing or an alternate to working with medicine.
I mean, but even with the use of psychedelics, all of these would still be advisable, right? I mean, talk therapy is beneficial. You know, it can even be even more beneficial if you use it in tandem with psychedelic assisted therapy, as well as, grounding, meditation, mindfulness. All of these things are helpful on their own. But I'm guessing that, psychedelics can help you. mm, Incorporate them more into your life because you're able to make these shifts that you mentioned.
Yeah, yeah. I think one of the most important pieces of working with psychedelics is the processing, whether it's with a therapist or a friend or a journey, is the people call it integration. There's this buzzword
Mhm.
in the psychedelic community, but integrating the experience into your everyday life, and that can be hard work. That psychedelic experiences can bring up some challenging things, and we might want to just you know leave it at the retreat weekend that we had, or leave it wherever and people can do that, or we can dive in and really try to integrate what we learned and what happened and what we saw, and make meaning of the experience. And I think that that does happen after the fact for me, since I'm a therapist, that integration piece is done in talk therapy. And so um but I think the same goes for breathwork experiences and even meditations, anything that brings us to an altered state um can benefit from having an integration process after.
I'm guessing that this is also one of the main reasons why recreational use of psychedelics is not as effective therapeutically as, like, directed, because You just said, right, that sometimes you just want to push it away and kind of avoid the integration, especially in cases where there's like really frequent recreational psychedelic use. And that might mean, in some cases, if it's very frequent, even if you want to have the integration, you never allow yourself time to integrate because you just supplement that with newer and newer psychedelic experiences. And I'm guessing that yeah, that's why integration, is like it should be more than just a buzzword, I guess.
Yeah, yeah. That's two really great points that are coming to my mind. The first is giving time between
Mhm.
big experiences to first and foremost let it settle in your body, let it settle in your experience, and then to do the integration. And when we're doing, big journeys close together, we don't offer much time for that to
Mhm.
happen. And I think that um the other piece is the intention behind the experience.
Mhm.
That's so important, especially when you are doing this in when you're doing this in an intentional way and you want to explore, I don't know, something that happened, or you want to look at self-love, or you want to dive into a grief process. The intention behind the journey is really, really important. And, for some people that they just want to have fun and party at, a festival, oftentimes that's what happens. And that's really great for them because they set out to have a fun time and they did, and great. And sometimes, things can go awry and, they're pulled in a different direction. I think that, with psychedelics, I learned years ago, and this term has stuck with me, a non-specific amplifier. The psychedelics are a non-specific amplifier,
Mhm.
and I understood that to mean that these amplify whatever's happening. And so if you are intentional and preparing for your experience and focused on, you know, say self-love, and the days approaching the journey, you're thinking about self-love, oftentimes that journey will kind of follow some semblance of your intention. If you are, I don't know, just had an argument with a friend and you're like, I don't want to deal with this. And you, I don't know, take a high dose of something. Sometimes the argument stuff can come in. And so, I think the intention behind the experience is really, really important. And that said, sometimes, I do see these as medicines. I do see these as healing. And oftentimes you get what you need and not what you want. That's also
Mhm.
like a buzz term in the psychedelic world, but it is so true. And I say that from personal experience as well as being a facilitator. Sometimes you go in wanting to explore self-love and you're guided in a much different direction. And it's fascinating. But oftentimes it is, I don't even want to say often, it's always it's always what you need to look at and address, in my opinion. So I think the intention behind it though is really, really crucial.
But often the most difficult experiences end up being very therapeutic, actually.
Yes, 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 yes. With openness, curiosity, and surrender. Those are so important. When we don't go into it open, when we're not willing to surrender, when we're not willing to be curious if something is challenging or brings up some fear, that can make us closed and resistant, and then it's more of like a battle of a journey, rather than letting go and surrendering in and just being curious. What do I have to learn? What is this teaching me? What is this showing me? What do I
Mhm.
need?
And also to return to the previous point, one of the earliest points about this shift, I guess, both psychological and physiological that psychedelics kind of spur in you. Uh, would you say that this is the main difference between other substances that are used in therapy or in conjunction with therapy? Because you said that the shift is necessary when there's like a feeling of stuckness.
Mhm.
And I'm guessing that, these pharmaceuticals that are, used to treat anxiety, depression, stuff like that, will only perpetuate this feeling of stuckness because they will kind of numb it and they will not make it go away. They will kind of not make you think about it and make it less significant, but they will just prolong the whole thing. And I'm guessing that this is why psychedelics can be much more effective than something like, I don't know, some pharmaceuticals.
Yeah, I would say that I agree with that. And I do think that medication serves a purpose in certain situations with certain people.
Hmm.
Some people aren't open to this type, this type of work, and it's too much or it's too intimidating. And, they found an antidepressant that works and they've been on it and it's fine and they're okay with that. And so you know, I think it's more about what works, but to
Hmm.
your point, I think that the shift is not being made with pharmaceuticals. It's just kind of addressing the symptoms rather than the
Hmm.
problem. And so the psychedelics, whether you like it or not, often go directly to that problem and really show you. And so yeah, I think that that's the difference between psychedelics and pharmaceuticals. The psychotropic medication that's prescribed, like your antidepressants, anti-anxieties, and things like that.
Hmm. And have you only worked with psilocybin mushrooms, or have you used other psychedelic substances in your therapy?
So I work with ketamine therapy, and then I work with psilocybin and MDMA. Um, I've not done an LSD session. I'm able to, and it's just a very long commitment.
So, what would be the main differences in the therapy for these three substances? So, or maybe in which case or for what kind of patient, what kind of scenario would you use each of these?
That's a great question. It's interesting. There's not necessarily you're depressed, so you get this. You're anxious, you get this. First and foremost, it's what people are open to. And I feel like ketamine, I'm in New York and ketamine assisted therapy is legal. And so totally legal above ground. So there's lots more conversation about it and discussion about using this as healing. And there's companies that are advertised, so people are hearing a lot more about ketamine
Mhm.
therapy. And so for some people they're like, they want to do that because they heard about it. Ketamine, the positive with ketamine is that it's shorter duration.
Mhm.
It's about 2 hours, hour and a half to 2 hours that you're kind of in a process, whereas psilocybin and MDMA is 5 to 6 hours that you're kind of in a process. And so ketamine is there's lots of studies working with depression, working with anxiety, working with OCD. There's been some studies looking at suicidality and ketamine. And so I think one of the things that stands out with ketamine is that stuckness, and people can have some shifts with that. I had a client who did a ketamine session for her anxiety, and she just so she doesn't have anxiety anymore. And
Wow.
I don't know where it went, and I don't even like telling that story because that's like almost like an unrealistic expectation. So there's not necessarily one specific thing for ketamine. And similar with psilocybin. I think part of it is where the person is at, what they're wanting to get out of it. With MDMA, that one tends to be more heart opening, more loving, more warm. And so I definitely lean towards that if there's lots of trauma, if there's PTSD, if there's depression. Um, Sometimes I combine MDMA and psilocybin to the MDMA can kind of heart warm the psilocybin
Hmm.
to, in most cases to kind of ease the journey and ease the experience. Um, and so I don't have, I guess I'm not answering your question, but I hope this is giving you an
No, no,
understanding.
it's great.
Okay. Yeah. Yeah. For like I was saying, for some people, they hear about ketamine, it's legal, all these companies are talking about it. And so they reach out and, they'll do maybe a couple sessions and eventually, I often share that I work with other medicines. And so sometimes they're open to wanting to dive a little bit deeper and explore other types of psychedelics. So yeah, it's there's not really one size fits all or one size fits every situation.
Yeah, I guess one thing that I've encountered on several occasions is that MDMA is very advisable in like couples therapy exactly because of this openness, because you're able to communicate things that would maybe be very, very unpleasant or very, very difficult to talk about with a loved one because there would be all of these defense mechanisms and stuff, and this just kind of sets both people in the couple up for a more open discussion without feeling attacked, without attacking in turn as defense. I'm guessing that this is like one case where it can be a bit more. I'm guessing MDMA would be more advisable in a couples therapy situation than like high dose psilocybin or something like that.
Yes, yes, yes. MDMA certainly, everything you just said, it lowers those defense
Mhm.
mechanisms, lowers the walls, and allows you to um, say the hard things, receive the hard things
Mhm.
in a much different way. So absolutely, that is the case. MDMA also tends to make us want to be a little bit more chatty,
Mhm.
and have some dialogue and share and connect. A high dose psilocybin session um, can make you maybe less chatty and more internal process. Everyone's different. Everyone experiences it different, but yeah, that's a great example of using of a reason to use MDMA in a couple's experience.
Mhm. And yeah, you said that ketamine is very popular, not just because of its pop, because of the legality and related popularity, but also because of its short duration
Mhm.
and I mean shorter, I guess. And I'm guessing that if people are not as open to psychedelics, but would still be open to trying them. They would much prefer something that lasts 2 hours than something that lasts 6 hours. Also, with a 6 hour session, I guess there's more risk of, I guess, negative integration. Like, for example, you might have like a really good shift, but then because that feeling of psychosis does in quotation marks doesn't really go away, you might kind of start sabotaging the progress that you made in in the first part of the session. I don't know. Have you ever encountered something like this?
Um, I hear what you're saying. I totally could I don't think it's crazy. I think thankfully I haven't experienced that with any of the clients that I've worked with. Um I feel like oftentimes the way that I try to facilitate is kind of create an arc of the experience.
Mhm.
And so easing in and then that peak period, 2 to 3 hours. it being a process time or a deeper internal process time, and then this slow landing is kind of how I try to create an arc of the journey, and using um, music primarily, and
Hmm.
having that be a guide to the individual's experience. But everything you said is totally correct. There's some people that are like, 6 hours, what? And so
Hmm.
that's really intimidating. And one of my clients was like, I don't know, I don't like being high. I don't know if I can do that for that long. And so there's definitely a benefit to having something, even if someone doesn't realizes that they're high and they don't want to be high, we only have another hour
Hmm.
left versus, okay, only 4 more hours. And so that's a little bit different. And so I oftentimes that it's um just more manageable for
Hmm.
people that are new to the world of psychedelics.
Yeah, because then on the other end of the spectrum, you have things like ayahuasca and ibogaine, which are like super, super, super long lasting. But from what I've heard, they also produce, like they also help people to some of the biggest shifts if
Mm.
they can handle it. And, usually you don't really have a choice. You just handle it, right? Because
Yeah.
what else are you going to
Yes, yes.
do?
Yeah, yeah. Yeah, those are definitely on the other end of the spectrum from ketamine in terms of the power that they have and the healing that they're able to offer and the duration. um how they're served, and so there's a lot that goes into all of it, but it all varies, and
Mhm.
and I think that it all varies depending on the individual as well, like what's going on, what's their headspace, what's their intention, how open and comfortable they are. And so there's just a lot of variables that come into play.
Mhm. I'm loving this conversation, Angela. And before we start wrapping it up, there's one more thing that I want to discuss, which is not 100% related to psychedelics, but you did mention it at the beginning, and it's a key part of any kind of therapy, and that's self-healing and the importance of self-healing. Can we talk about that for a few minutes?
Sure, sure. Yeah, yeah. Um, as far as my thoughts on self-healing or my own self-healing.
Oh, I guess a little bit of both. Why not?
Yeah, yeah. Um, Yeah, so like I had shared in the beginning, I found this documentary and then just kind of dove into learning everything that I could about psychedelics in terms of healing. And I found a few different programs, some in the US, and there was one out of South America that really drew me in and drew my attention. And so kind of applying to different programs, eventually settling on the one in South America. And with that program, I feel like it's one of a kind. I've not come across any other programs um, that really offer what this program offers. And it's a combination. It's people from all over the world, and it's a combination of online programs, um, retreats, and then pilgrimages with different indigenous communities. And I really initially thought I was just going to go and learn about how to be a psychedelic assisted therapist,
Mhm.
but to my surprise, I really did a deep dive in my own past, my own experiences, and my own traumas, and having a big part of the retreats and the pilgrimages is an experiential component of working with different medicines and learning how the different indigenous communities use these medicines as healing. So I've had different experiences with our the team, the teachers in the program, in the retreats, as well as with different indigenous communities. And so I've really been I feel like I'm so lucky to have had all these opportunities to deep dive in my healing. And I feel like they've changed me. They've changed
Mm.
who I am, how I am. I'm a mom. I have two kids, and so they've changed how I parent. Um, more patience, more ease, less anxiety, more openness, just more of an expansive perception on everything. And so I think having had that experience and knowing the power and the beauty of that, I very much feel that self-healing is a game changer. And that's really what led me to really wanting to be able to offer a space for people to do their work, their self-healing work, because of how impactful it's been for me.
That's wonderfully said, wonderful thoughts. I guess often the most effective healers are the ones who have healed themselves, basically.
Yeah. Yeah. I was a traditional therapist. I did undergrad and then I did my master's degree and I did my internship hours and all of that stuff. And none of that came close to the healing work that I've done. And education's important. We need that. But I think that having been able to go through my own healing allows me to really connect in a different way with the individuals that I'm working with as they're on their own healing journey.
Well, speaking of, if anybody listening right now would like to connect with you or learn more about you, what's the best way to reach you online, Angela?
Yeah, probably my email. I don't have a website. I try and stay under the radar. So probably email would be the best. It's just my name, Angela, Angela dot Amoia, Amoia at gmail.com.
Okay, awesome. Thank you so much for this conversation, for taking the time to speak with me. It was really, really fascinating. I really enjoyed having you on the show, Angela. Thank you.
Thank you. Thank you so much, Tim. I really appreciate it. It was a pleasure to be here.
And well, to everybody listening, thanks again for tuning in. I hope you also enjoyed our conversation, and I'll see you all again next time.